Okay, Dr. Leachon, please proceed. You
Yeah,
come very well represented by Senator Zubiri.
Mr. Chairman, Senator Gordon, thank you. Honorable senators and members of the cabinet, colleagues, I'll just make a very brief presentation on the rationalization of vaccine supply and the Delta variant environment. So this would be just a very short 10-minute presentation. I'd like to present a snapshot of the global and the Philippine COVID data and addressing the Delta and the other variants of concern. And what is the success story for India, considering it had 400,000 cases and right now it's just about 40,000. And then how do we rationalize our vaccine portfolio in relation to the Delta variant? And of course, in the Senate and the Congress, we need this particular August body right now to create certain laws. And with some stakeholders, we crafted this particular pandemic checklist. So right now we have 205 million cases all over the world with 4 million deaths, and leading that is of course US, India, and Brazil, and then Russia, France, UK, and the Turkey. Now with the three successful countries who have actually achieved vaccination at around 60%, but because of the Delta variant, they actually have this resurgence like Israel and the United States and of course the United Kingdom. So we call this the breakthrough infections, and we need to address this as well. Particularly, we are in this particular surge. Now, this is actually from India. In April, they had this particular case of 400,000 cases and 4,000 deaths. That's a staggering number. And look at this particular downward trajectory. It's almost a flat line right now. This is 46,000 cases a day. So, so this one really intrigued most of us. Why? Bakit ganun? Ang India, akala natin, well, epicenter of the world, and yet ito successful. So we need to look at this. Now, this is the Philippines, and I got this from, of course, from Edson Guido. We had three surges before. The long lockdown, and then with reopening the economy, and then you have a very long quiescent period, and then with the arrival of the variants, the UK, the South Africa, we reach the peak around 15,000, and then with the ECQ, they have a downward trajectory. But of course, we did not manage it well because we need to manage it around 2,000 cases. Then we reopen the economy, and then with the Delta variant here, we're trying to control this with the surge. Now, this is actually yesterday, but I got the number today. So we had right now 17,000 cases, and we have 26% positivity rate. That's very high, all-time high. And it means that one in every four Filipinos will be positive. We have right now increased testing at 70,000. Our target is about 100,000. And then we have increasing number of cases. But what is really very, very sad here is about the healthcare utilization. We are high risk right now po. Ang high risk po is defined as more than 70%, both at the national level at the national capital region. In America, US, and Israel, they're only using two parameters. The level of the positivity rate, because mag increase ang cases, marami pong mamamatay, at puno po ang mga hospital. So, ngayon po, of course, we know that we are in a record high, 18,000 last week, last Friday, and this is because of the Delta variant. And this is actually declared by our Department of Health. Now, tingnan ho natin ngayon, kasi importante sa atin strategy, aside from what Secretary Duque told us, but to simplify, it's actually testing, tracing, and vaccination. 54% po ng ating bakuna is actually Sinovac, and you can see here sprinklings of the other vaccines. This is important in the light of the Delta variant because a variant can actually be highly transmissible and render some of the vaccines ineffective. Now, this is actually a pie chart to tell us that most of our orders are actually Sinovac. And I'm just trying to tell you, honorable senators, that 50% of our orders are actually on Sinovac. Now, what is the problem with this? And this is what we got from the National Task Force. So consistent with the number, 48,000, all right? We have this 408,000 doses. And our current vaccination rate is 12%, very far from the herd immunity, which is basically 70% of the population. Now, this is coming from the vaccine expert panel. And there are only 5 vaccines that will be effective for the Delta variant. And this is based on their efficacy rate, this particular column. What are these 5 vaccines that will be effective? Okay, Pfizer, effective for the Delta variant. AstraZeneca, effective for the Delta variant. And then Moderna, effective for the Delta variant. Janssen, effective for the Delta variant. And one particular vaccine coming from India. This is effective for the Delta variant. There are no published report for Sinovac and of course for Sputnik. So yun ho ang nakikita natin na are we ordering the right vaccines? Considering we're dealing with the Delta variant, to yun eh. Kasi kaya magkakaroon ho tayo ng problema sa breakthrough infections na nangyari sa Amerika. Even in America, 93% of their cases right now ay sinasabi pong Delta variant. And they're using high-quality vaccines like Pfizer, and they're using Moderna, and of course, Johnson& and Johnson. Now, ang Covaxin, according to an expert panel of the DOST, Dr. Ronjan Solante, and the head of the infectious disease section of the San Lazaro, pwede daw po yan gamitin. It's another perspective using the India model. Now, this is Professor Gloriani. Nina Gloriani is the head of the vaccine expert panel. And she said that we're not just talking about the Delta variant here. So far, the Sinovac has data on the efficacy on the Alpha, the UK, and the South Africa. They have at least, I think, 6-fold reduction. Kasi pag gumamit ho kayo ng bakuna, nababawasan ho yung tapang ho ninyo. But they have no data on the Delta variant, which have affected Indonesians, ganun din India, and other countries. So ito ho yung napaka-importante so that we can project what particular vaccines will be effective in the future. Very important yan. Now, we know for a fact, and I believe Secretary Duque and Secretary Galvez by saying the wealthiest countries have 40% of the orders and only 11% of the population. But look at India right now. Kahit ko konti, they are able to produce and maybe perhaps after their success, they can actually give us some of the vaccines. But look at this particular slide, and the country of origin, the Delta variant, is actually India. And look at the downward trajectory at this point in time. Now, we look at the data coming from Covaxin, and I got this also from some of the experts. They have the largest efficacy trial in India. They have also effect on moderate and severe disease. And this can actually be reviewed. Ito po ina-approvean na po rin ng US, ng ating local FDA by DG Eric Domingo last April. Ang problema ho, last April, right now, August pa ho, wala pa ho tayong procurement dito. Of course, we don't know the particular situation, but if you look at right now solutions, this is one particular solution that we can actually provide for our countrymen. Now, ano ang success factors nila? From 450,000 cases, bumaba sila sa 25,000. So how did India decrease the surge? It's actually a rapid or a blitzkrieg vaccination drive, massive testings, and of course, tracing. And the vaccination drive is important to reduce the hospitalization. And it is important. Look at this particular number. India reached a record-breaking 8 million doses in June 2021. A record 9.2 million doses in June 21 and an average of 5 million doses per day. Now, according to the CDC, with the Delta variant, we need around 85 to 90% herd immunity. Hindi na ho pwede po daw yung sinasabi nating herd immunity na people's protection with 50% because the dynamics nag-iba po right now because of the Delta variant. So ang target before natin 70%, but this may not be effective in the presence of a Delta variant. And herd immunity will actually prevent the viral transmission. So in terms of the regulatory process benchmarking with the rest of the world, ang Philippines may procurement process but many safeguards to ensure the safety vaccines are introduced. But however, these built-in safeguards can also lengthen the process of procurement. And our requirements to purchase the vaccines will emanate from this. You have an EUA approved in April. You have the HTAC recommendation, but there's no clear time for approval of the process. The multi-party party agreement with the NTF and the no clear timeline as well. And many, of course, of the private sector stakeholders, even, of course, the LGUs are waiting for the signature of the NTF and DOH on this one. Many countries have actually streamlined their application on this, and several things have been done in order to fast track the registration. Now, this is actually my last slide, and this has been the product of the stakeholders, particularly the medical experts. And I'm sure this has been discussed by Senator Gordon, particularly the second one. The first one is, of course, to legislate ventilation and, of course, free testing for essential workers. And then perhaps getting a contact tracing from the best practices like South Korea or Singapore and increase our internet access. Create a network of health facilities from barangay to tertiary hospitals. We are doing that right now, but we need to do more because these are the heroes of our this particular pandemic. We need to hire and improve the healthcare workers, provide timely and complete case data. There should be no late submission, real time, because we're dealing with the pandemic. We need to provide clear and consistent messaging, and of course, improve safety in the mass transportation and keep the vaccination process simple and transparent and provide economic stimulus and relief. So with that, in summary, Mr. Chairman, India as a model country has demonstrated that testing, pre-testing, contact tracing, and rapid vaccination work. Delta variant is the greatest game changer in the world. It has actually changed the landscape of management. And right now, the herd immunity should not actually sit on 50 or even 70, but we have to target 85 to 90%. The Philippines needs a multiple vaccine procurement plan ASAP to address the rapid surge of the Delta variant. And rapid vaccination is an imperative to achieve the herd immunity ASAP, leading to reopening of the economy. So I'll stop there, Mr. Chairman and dear senators. Thank you very much for your kind
Thank
attention.
you. Let's be fast because it's getting late. Uh,
Very
Thank you
much.
very much, Dr. Leachon, for a very succinct presentation. I think Secretary Galvez also wants to make a presentation. I don't know if it's a rejoinder. I hope you can
Uh,
make the
just
trains meet if there's any disagreement. Go ahead, please.
I have some disagreement on the Indian model because I think the good doctor doesn't present the true data of vaccination of India. For this day, India already vaccinated 603,846,475. And Covishield is the one they used predominantly. I've been in India for almost 3 days to study their model there. And Covishield is only measly 21,041,285 being used by only 5 countries. I believe with the 1.3 billion, 21 million is not is negligible in terms of really looking at the data that it is better than Delta. So meaning most of the studies that I have read and also have been presented by FDA that really Pfizer and also uh, AstraZeneca works against the variant, though it has been limited. Its efficacy has been limited to negative 10 to 20 or 30. And I believe based on the real world data, Sinovac also is working, especially in PGH. I have the data of PGH that it works against death and also severe cases. As of now, all the I have the report of the PGH director, Dr. Gap, and I can show you that all vaccinated there is no people that had been intubated and been critical with vaccination of AstraZeneca and also Sinovac, meaning all vaccines that we have procured are no they works against Delta in terms of in terms of what you call it, the severity and also in hospitalization, considering that the majority of those, those hospitalized are 85-75%. And based on the data of PGS that submitted to me just yesterday, it shows that there is no vaccinated people that has been intubated. And I believe Covishield, the data of Covishield is still, I have some expert from WHO. They said that Covishield they still lack data. And I believe, considering that Sinovac has an EUL, WHAUL, it is more significant to say that Sinovac works in Delta. I have a strong feeling that all of our vaccines that we have procured, including Sputnik, considering Sputnik, they have some sort of initial protections. Even the first dose, there is some reports that even first dose they have initial protection because Sputnik has already an efficacy of 70 to 83 first dose. That's why the FDA has already approved Sputnik Light with only single dose. I believe also Johnson works on the variants because Johnson and Johnson is second generation vaccine. It was tested on different variants, including South African, UK, and also Delta variants. I believe I can because I'm not an expert, but I can say that for the meantime, the real world says, and the PGH and also the St. Luke's study, all of our healthcare workers are vaccinated by Sinovac and AstraZeneca. And we have never heard any casualty on this, on our more than 1.7 healthcare workers. That's I observe. But I am not an expert, but that's the real observation that I have.
Mr. Chairman.
We really have to start going. Very quick repose. Are you going to have a repose, Dr. Leachon? I think
Yes,
you
sir.
said basically the same things and just a slight degree of the differences. I mean,
Yes, sir.
uh,
Yeah, Mr. Chairman, I concur with Secretary Galvez. What I'm trying to propose is that the preferential choice of our country is more on the Chinese vaccines. I'm not saying that it's not effective, but based on what we have right now in the best countries, even in the US, we need to try a multi-vaccine procurement process. And that's why on September 20, President Joe Biden will start with their booster dose. So a booster dose would be a higher efficacy rate than the current vaccines that we have. And that's the reason that we're working on this.
you do
Because if we're
mean
just
mixing Moderna and Pfizer, for example? Is that what you mean by multi-dose?
we can sir we need to procure sir vaccines with higher efficacy rate than our present crop or portfolio. And with this, with the Pfizer, Moderna, and Janssen, we need to go through the channels, particularly that the Pfizer has actually secured an FDA approval for commercial use. So what the DG of the FDA should do is actually get the regulatory approvals so that we can fast track right the Pfizer arrival here, and then we can actually do, of course, prioritization of the senior citizen, the comorbid conditions, and even the children. We need to move on that particular angle. So what I'm trying to say is that we need to understand also the booster doses. We need to plan also for the mix and match. And other countries like our OFW, when they go to certain countries, some of the vaccines that we are using are not actually honored by those countries. We need to project this kind of particular situation, and we should not be actually boxed in a certain situation. That in the long run, when we have the Delta surge, we are left with one option only. We need to have multiple vaccine options, sir.
All right,
I
very
think
quickly, General Galvez, very quickly.
I
I'll
think
ask
that
Secretary Duque afterwards. Go ahead.
Sir, I think Dr. Lechon's data is faulty. He is claiming the bulk of order is Sinovac. Actually, we have a bigger order with Pfizer, 40 million. We have also order from Moderna, 20 million. Our order with Sinovac is only 26 million. But remember, our main problem is steady supply. Our supply for uh, for Moderna and Pfizer will only pick up on the fourth quarter. And what we will do now, if you are recommending for accelerated, massive, and even rapid vaccination, how can you vaccinate with only seven doses, 7 million doses available in September?
Yeah.
So that's I think your premise is that we have only ordered Sinovac. We have ordered seven types of vaccine. J&J, there is a problem of their logistics, considering that Johnson and Johnson might give us
My
the
attitude,
volumes maybe at the end of the quarter.
my
So
attitude is every vaccine has its efficacy. And if
yes,
you can get the
that's
best vaccine, that's fine. If Sinovac is good to defend, that's fine. The important thing is vaccinate right away and then go into other things that can boost the health of our country. But in the meantime, it's not the policy of beggars cannot be choosers, but really let's get it done right away. But at least there's a measure of defense whatsoever, and eventually we can actually move on forward. Senator, Mr. Miss Vergeri, quickly please. Yes, I'll call you Senator Locson. Go ahead. And
Yes,
after
Yes,
very
sir.
Senator
quickly.
Pia.
I have very quickly, Mr. Chairman. I have a question for Secretary Galvez. What is the total number of vaccine doses that we have procured and booked for delivery? Yung total talaga. Maski yun na ibakuna na, yung total number.
sir, ang natin sir, ang naibok na natin.
Donated and bought.
Yes, sir, ang sir natin, if COVAX will supply 49 million, including that the 5 million that we ordered.
No, hindi na muna yung if, yung talagang book na for delivery.
For
At saka yung procured na.
As reported by DOJ, DOF last night, we have booked already 194 million.
194.
Yes, most of them are we have 40 million Pfizer.
This is the total
Yes,
number.
yes, 40 million Pfizer, 20 million Moderna. We have 26 million Sinovac. We have 10 million from Sputnik, and 49 million for COVAX. And we have ordered also another 10 million for September for Sinovac, and another 10 million for October, because we will have some sort of a depleting supply if we will not order another 10 or 20 million of Sinovac.
Pero yung siguradong overall total is 194. Yun ang sigurado
Yes,
na.
Yes, Your Honor. And I believe, based on our vaccine expert panel, all vaccine works on their own. Meron po silang characteristic that even offset others, and also they are all useful. They are all useful even to the variants.
So this is good for 98 million
Yes.
recipients. Ano?
Yes, sir.
Yung
Actually,
194.
for 110 people, considering that most of if we will buy the Sputnik, it is one dose. 10 million of J&J is another one dose. That's already 10 million treatments.
But of course, may allowance tayong 5% sa spoilage. And
Yes, sir.
of course, yung mga lumalaktaw na nagbo-booster shot ng third shot. Di ba meron mga ganon?
Sir, we are
Kasama
not,
na sa 5% yon.
yes, sir, we accounted for 5%, but we are very happy that our sleepage, our wastage is only 0.002.
Thank you. Thank you very much, Charlie.
Sir,
Uh,
sir.
uh,
Just
just a
one more
moment.
lang, sir.
Just a moment. Just a moment. Secretary Vergeri, very quickly.
Yes, thank you very much, Mr. Chairman. I just like to manifest and second what Secretary Galvez said. We already have evidences for Sinovac. And just recently, there's this study wherein 10,000 plus people were vaccinated with Sinovac. And it showed 100% efficacy or protection against severe infection. So we just like to mention that because we know that this might erode the confidence of our public, because this is being live streamed, and statements of Mr. Leachon can be very risky for the confidence that we are now having for vaccination.
I don't think that was his intention. He's just saying what is best. And certainly, and I followed it up, you heard me, that a vaccine will protect. Vaccine protects. Doesn't matter which. Better to have a vaccine than none at all, and get the best as much as you can. in accordance with what our pocketbook can get us. Actually, we should always try to get the best. But as far as I'm concerned, we're on the right track here. Dr. Leachon, very quickly.
Yes, sir. What they're trying to project, sir, is the vaccine nationalism. Kasi eventually, sir, that dapat meron tayong sense of vision. The stocks are in order natin right now. But if America and the rest of the world would need it, then America will actually be having a difficulty getting the vaccine sending out to the rest of the world. We're not trying to project dito lahat ng vaccine effective. But we're thinking right now kung bakit ang ibang countries ay nagbo-booster doses. Like for example, Indonesia shifting from Sinovac, let's say, to Astra, like Chile and other countries. We're trying to say reality. Kaya nga sinasabi ko clear and transparent messaging. All the vaccines gamitin natin with the backdrop that later on we will need a booster dose for all the vaccines that we have right now given the efficacy rate, and then later on, yun ang sinasabi natin. Now, if we're not going to plan for the future, then we're left out right now ordering some vaccines that may not be effective for the Delta variant. That's what I'm saying. We have to maximize our portfolio right now and position each particular vaccine on the strength of their particular attributes. Okay, yun lang po, Senator.
You're all on the same page actually, but it's just a question of just be careful because they might swing away from vaccine na sabi mo medyo low efficacy. As far as
Right.
I'm concerned, yung mga nakikinig dyan, lahat ng vaccine okay. Kung makukuha nyo na, kunin nyo na. Huwag kayong maghintay. Dapat pag tinamaan kayo, wala kayong kadepensa. May vaccine ka na, tatamaan ka pa eh. Kaya dapat mabuti may vaccine ka para sa ganun, kahit tatamaan ka, may labang ka. Yun lang ang sinafollow natin. And if we can get the best, dapat gawin natin ang the best. Kaya kailangan planuhin natin ito as a country. Hindi yung lahat magaling o lahat nagmamagaling. Ang importante talaga yung tao ang iniisip natin para may angat natin sila sa karimlan.